Well, is it a cold or COVID-19? With cold and flu season making a comeback this year, many people are asking themselves this question. We spoke with doctors across the metro to help you decipher the symptoms. KCTV5's Carolina Cruz is live with information tonight to help us sort it all out. Carolina?
A family physician that I spoke with says that he has been fielding a lot of calls from patients wondering the same thing. And he says that the only sure way to find out if you have a cold or COVID is to get a test. Common colds and flu took a break during the last year and a half.
Considering 2020 to 2021, we didn't see any influenza. This year, we have seen significant amount of influenza.
This season, the sore throat, runny nose, and cough, all symptoms of the common cold, are back. Family doctor Todd Fristo with St. Luke's Health System says he's been treating more patients with respiratory viruses other than COVID.
It's been very challenging because before COVID, you would just kind of treat it as like a viral upper respiratory infection or a cold. And if they had fever and chills and felt really poorly, you'd think it was more influenza. But now COVID has kind of added a whole new layer of complexity to try to figure out what to do and give proper recommendations.
Dr. Fristo is taking a conservative approach. He's having patients with cold-like symptoms get tested for COVID before an in-person visit. Dr. Sale Weiss at University Health and doctors at the University of Kansas Health System also weighed in.
Unfortunately, to some extent, there is not a great differentiating factor because some of the early symptoms of COVID and cold are very similar.
There is absolutely no way, based on symptoms, that you can distinguish between a common cold, Omicron, and Delta.
Keep in mind, body aches, fever, and shortness of breath are more common symptoms with COVID. But doctors point out rapid tests have a harder time detecting the Omicron variant of COVID.
If it's negative, I would really encourage folks to go and get a PCR because it could be falsely negative or you could have a different virus. And we really want to make sure that we understand if that's a false negative or a true negative.
All week we've been talking about how those COVID tests, even the at-home ones, are really hard to come by because of the high demand. But even people who are able to get a test right now are having to wait. Labs are backed up, not only because of the high volume of tests, but also because they are experiencing worker shortages too. Reporting live, I'm Carolina Cruz, KCTV 5 News.
Yeah, it is a struggle for so many. Carolina, thank you.